Right now in our community, about 1 in 5 adults experience some kind of mental health or behavioral health crisis at least once in the past year.
No one is immune from the behavioral health issues that are affecting the community. If it's not like your close relative, it's your next door neighbor, and if it's not your next door neighbor, it's someone way down the street. But be that as it may, they're all going to affect you.
In 2014, Bernalillo County in central New Mexico set out to create and build a regional behavioral health system, one that provides services to every walk of life and every age that is living with a behavioral health condition. Bernalillo County's Behavioral Health Initiative, administered by the Department of Behavioral Health Services, has taken on this mission. They know that crisis services are some of the most urgent needs for immediate help.
Perfect example would be, let's say we had somebody threatening to jump at the overpass at Wyoming and I-40. Normally, what we do is we'd have a CIT officer respond to the scene and handle that and have somebody called out from a specialized unit. With the mobile crisis team being in the field, they could respond to the scene and be there much quicker and provide resources that only the clinician has available to them to help resolve that situation quickly and effectively.
If they need to go to the hospital, we take them to the hospital. If we need to refer them to community mental health services like St. Martin's or some other organization, we'll do that on the spot.
Lisa is part of the mobile crisis teams, a first of its kind for the county and city of Albuquerque. She's part of a 2-person team that blends clinicians from partners like St. Martin's Hope Works with police or sheriff's deputies, bringing the services right to the person in crisis.
We're usually at a client's residence or sometimes their workplace. Sometimes, they may be on the streets. So we'll visit them where they are.
For all the first responders, officers, deputies, and firefighters, having a master's level clinician respond to mental health calls created a major shift in how these calls were handled.
We're trained in first aid and medical procedures, but not necessarily in issues that pertain to mental illness. And this allows us now to know that there's an expert in that field on their way, and we can then turn a patient over to that expert. And that's something that has really become, I think, comforting for the men and women in the field to know that we can take our patient and hand them over to someone who can provide a level of care that we just aren't really equipped or adapt to do.
If we can divert from jail or even the hospital, that's the best choice.
All of the programs created through the Behavioral Health Initiative, or BHI, are data-driven. The mobile crisis teams are no exception and are generating positive results.
We would ask our dispatch center to dispatch one of the mobile crisis teams, and we would wait with the patient until one of those teams arrived. At that point, then back to the initial question, they would be able to provide, a full evaluation on the individual and perhaps prevent them from having to go to an emergency room.
Of the more than 1,000 calls the mobile crisis teams respond to annually, only 3% of the individuals they engage with actually end up going to jail.
Many people have dual diagnosis, and they have a serious mental illness, they have a serious alcohol problem, they have a serious opiate problem, they have a serious drug problem. And so the best way if we're going to have a change is we treat them collectively, treat them the same, treat them with the fact that they have a disease that we can do something about.
Which is why what we call the crisis continuum within the Behavioral Health Initiative resembles a spider web. It's, in essence, a net that ensures that no one falls through the cracks and that everyone who needs help gets it.
There is a more unified mental health community growing, where people can refer to other institutions depending on ages or genders or whether there's been incarceration or whether there's children. And so there's just much more interchange in helping communities.
Enter the Community Engagement Teams, or CETs, operated by New Mexico Hope. This first-of-its-kind program nationwide is one example of how the net works to provide stability.
I think the ability for us as community engagement teams to really engage people through peer experiences rather than through a clinician or through some sort of state entity, I think we offer much more hope.
Maria, a CET peer counselor from Shiprock, New Mexico, never expected to get into this field until someone recommended it because of her own past experiences.
Alcoholism runs deep in my family. My parents were alcoholics, and for me, that hit me the worst in my family.
New Mexico Hope accepts calls from the community as a whole, as well as referrals from other providers within the net of services, including mobile crisis teams and the New Mexico Crisis and Access Line, or NMCAL.
Connecting with the person that is reaching out for support. I let them know of my lived experiences, and that's where the connection is built. They're more open and more receptive of receiving mental health services.
I think our peers laugh at me when we first hired and started. My wife had lifesavers all over our table, and we have a jar of lifesavers, and I reminded them, you guys are changing and saving lives every day, and for many people, you're gonna save their life.
In the first year, Rocky says they've received more than 1,000 calls, and that it helps to take a team approach with the people they serve.
That's what's really cool, is that we're able to really connect with people, and it's coming from community for community, which I think is a key to that.
If you or someone you know is experiencing a behavioral health crisis, please call NMCAL. They have paid peers and professional counselors available 24/7. To learn more about the Behavioral Health Initiative, visit www.bernco.gov/DBHS.
The BHI is changing lives.
The BHI is changing lives.
The BHI is changing lives.